March 13th. Despite what the clock says, it is actually 8:30, not 7:30. So we'll get started. Do we have any public comment today?
Who's in charge of the clock?
Al will get on that right away.
Al is in charge of the clock?
Ultimately, yeah.
All right. Seeing no public comment, we will move on to approval of February 27th meeting minutes.
Move it.
Support.
Moved by Commissioner Bunk, support by Commissioner Constantine. All in favor, say aye.
Aye.
Opposed? All right, moving on to item 3. I need Wayman to, do we need a motion?
We'll read it first then.
Okay, Wayman, you want to read it first?
Yes, we recommend, would like to recommend to the board to add the addition of 1 full-time health epidemiologist position in the health department to lead the county opioid task force. According to the Centers of Disease Control and Prevention, drug overdose deaths and opioid involved deaths continue to increase in the United States. In 2017, the number of overdose deaths involving opioids was 5 times higher than in 1999. More than 300,000 people died from drug overdoses from 2000 to 2016. On average, 115 Americans die every day from an opioid overdose. The CDC calls this the largest man-made epidemic in the history of the world. In Kent County, the rate of overdose deaths has increased 4-fold since 2000, with 70 opioid-related deaths and over 680 overdose-related emergency department visits in 2016. Kent County reported in 2017 93 opioid-related deaths with an average age of 39 years old. In response, the Kent County Opioid Task Force convened 3 years ago under the coordination of the RED Project through funding received from the Steelcase Foundation. Unfortunately, the funding from the Steelcase Foundation expires in April 2018, and the RED Project cannot commit to organize the task force beyond that time. The Health Department is in a unique position to provide this leadership and expand the strategy beyond naloxone distribution and education to include efforts that address prevention and access to recovery services. The total cost of salary and benefits for the full-time public health epidemiologist position is $95,920. The cost will be funded by general funds previously appropriated to the 2017-18 Health Fund budget via Board Resolution 928-17-75 for emerging issues.
So moved.
Support.
Moved by Commissioner Kornick, support by Commissioner Ponstein. Let's open it up for questions, concerns. Adam, do you want to come up in case we have any? Commissioner Steck.
Yeah, I have a couple of questions. I guess I'm looking at the last reference, last bullet point. Is this suggesting that the 95,000 has already been approved in the budget last September?
Yes.
And when we approved the budget in last September, was it for this person or was it just a general funding?
General funding for emergency issues.
Okay. And now this is plugged in as one of those emergency issues?
Yes.
Yes, that's correct.
Okay.
Yeah, the health department budget has always had a fund line for public health emergency issues, and we have very, very rarely used those resources. This issue, along with the other issue that we're going to get to here next, to my judgment, both rise to this level of public health emergency that require the sort of deliberate attention of a person whose job is responsibility, in this case with the opioids task force, and doing a number of things associated to that effort.
And then my follow-up question is, how does the effort of this individual, how does that coordinate with what goes on with the prevention services at the Lakeshore Regional entity?
Well, I think that would be an opportunity for us to improve that relationship. Right now, there isn't anything intentional other than the bit of work that we do with them with the My Recovery website and with pushing out messaging on substance use awareness, rethink drinks and things like that that we do, but there hasn't been anything intentional with the opioids. But I think this represents an opportunity to become more involved with that regional effort.
Well, I assume we'll approve this, but I would certainly encourage that coordination so that those efforts and the funding can be really targeted on this issue.
Absolutely.
Commissioner Korndike.
Thank you, Chair. Adam, in your memo to Wayman, you talked about this position and then also the position we're going to be talking about next for PFAS. How much money do you have set aside total in that emergency fund?
It is about $220,000.
Okay. So this is pretty much using it all up with these two positions. Okay. Thank you.
Commissioner Taylor.
Thank you, Chair. Morning, Adam. Could you talk a little bit about how this position, the work of this position, compares to the work that the RED project was doing? What's similar, what maybe is different, or a couple things are mentioned here in terms of prevention and access to recovery services. Could you talk about that a little more?
Absolutely. The RED project has been leading the Community Opioid Task Force for the past several years. Their work has been largely centered on naloxone in Narcan distribution and training the people who administer naloxone in the law enforcement agencies, first responders, family and friends of those who are either struggling with addiction or who are users of prescribed medicine. That's an important domain of work which will continue. According to the CDC, there are two other lanes of work that we should also be working in. One is prevention, which is true health education strategies to prevent addiction and misuse from happening to begin with. And the other is treatment and doing the sort of alignment of treatment resources, such as Commissioner Steck was questioning, and making sure that we have those inventoried and presentable to the community, and we have trainings to the community on how to access the treatment infrastructure that we have. So it's really expanding laterally into those two other domains that the CDC recommends. It's also going to be working in improving our data monitoring with opioid overdose and doing what we call social autopsies, where after we do have an overdose, we're working with the family and friends of that person to find out what was happening in that person's life in the days and weeks preceding that overdose, so we can better understand where the windows of opportunities are and what are the risk factors that led to that event.
Just a quick follow-up. Do you feel like one position is enough to meet the need for this at this time or in the near future? Or do you see my understanding is there potentially are some additional funds becoming available, state, federally perhaps. Is there more that we can do? Is this kind of just the tip of the iceberg?
Yeah, so we'll aggressively pursue any other opportunity that comes along for us to expand our resource, our response to this problem. We also, however, feel that there are tremendous resources already in our community that are looking for a coordinated response. And I've spoken to them many, many times in different walks of life, whether it's in the criminal justice system or in healthcare delivery or in the faith-based community that are looking for one organized response to this and trying to find where they fit in that. It's been one of the biggest challenges in this opioid problem is that there are so many organizations that recognize that's a priority, but they're not seeing their fit. And so if we can build really a community effort with leadership in part from this position, I think that'll go a long way to bringing the resources that we already have to bear against this problem.
Commissioner Vaughn.
Yes, thank you, Chair. Probably directed to Wayman since I don't serve on the finance, and it's been a while since I've been on the finance committee. And a follow-up to Commissioner Korndike and Commissioner Steck. Does each department have money like this for a crisis, sheriff department, if they need some additional funds immediately for something that would show up, or the health department in the future?
I don't believe every department has what we would call an emergency fund like this, because of the nature of the work that the health department does, they do. However, Each department, when there's a change in the way that their operation is meeting a need in the community, they have the latitude to move dollars from a different line to another line to take care of a shortage. So from that perspective, every department has an opportunity to gauge where they need to move dollars to meet a particular need. However, in this case, this is a specific budget item that the department actually built into their budget and has been doing that for years.
Now that they've spent down, if they needed additional funds for some other issue that came up, then they'd have to go through finance and go through the board?
If they go beyond their allocated, appropriated amount, they would have to do that. But we're hoping that with the way that we plan our budgets, and it's simply, budgets based on what we anticipate will be the needs for a particular year. So we expect that the health department will maintain the budget that they have. If they need additional funding, of course, they will need to come back to the board or identify other grant resources, other resources from the State Department or other places to fund whatever they need.
Okay, thought that's how it went, I just wanted to verify how that worked. Thank you.
Commissioner Steck?
Thank you, Chair. Just to follow up, I noticed that, I think it was Eldrick County that filed their opioid litigation this past week. Does this qualify as a damage under the opioid litigation? Do we have to do anything special to make sure that it is identified as responsible?
Actually, Commissioner, we did talk about that in how we structured the action request this morning, so that when we join one of the cases, this would be part of the damages that we would seek reimbursement for, yes.
Thank you.
Any other questions for Adam? I have a couple quick ones. When you're doing this assessment, or once we hire this person, can we collect or somehow measure, do we have enough providers in the community to address this need?
Yeah,
Are we already planning to do that, or can we?
I think that's a critical question for
Okay.
this opioid task force to deal with.
Okay.
And if there is a shortage, that's something that we need
Yeah.
to bring back to the community as a whole.
Yeah, because I think we have some pretty responsive, providers and resources, but we all need to communicate the need. And then my second question is on there was a big package of opioid legislation that moved through, I think, end of last year. A lot of it requires providers to check a universal MAPS system. How do we interact, or how is this person going to kind of play into that field at all? Do they have access to the maps, or how does that work at all? Do you know?
Yeah, so we wouldn't be enforcing the legislation that was passed earlier this year, but I think that the health department is in a unique position to educate and to bring providers along, and that would be part of the role of this position, but also it's part of the role of our medical director, Dr. Hall. We have found that oftentimes the best person to teach physicians is a physician. They seem to have a greater respect and attention span when they're hearing it from a colleague. So we have had that as part of our plan internally, is to have an effort through the Kent County Medical Society and other resources to really reach out and to expand our training and encouragement of providers to use resources like MAPS.
Thank you. All right. There are no more questions for Adam on this specific issue.
Take a motion.
We have a motion. Yep. All in favor?
Was there a motion?
I
Yes.
moved it.
Yeah, there's a motion in support. All in favor of moving forward with item 3, say aye.
Aye.
All opposed? All right. Move on to item 4. Wayman, would you like to read?
Sure.
Item 4?
Yeah, this is a recommendation for the addition of one full-time public health epidemiologist position in the health department to assist with PFAS, vapor intrusion, and other environmental issues. Since early 2016, the health department has been involved in the investigation and response of several emergent public health threats, such as vapor intrusion and PFAS contamination. April 2017, the Health Department became aware of an investigation regarding contaminated groundwater in the Belmont area by the Michigan Department of Health Environmental Quality. In the months that have followed, the wells or more than 1,000 homes have been tested for PFAS. The Health Department has been on the front lines of informing, educating residents regarding test results, the known health consequences of PFAS, and ways to limit exposure. The Health Department has organized 2 town hall meetings, bringing the Michigan Department of Health and Human Services, MDEQ, and Wolverine Worldwide together to address residents' questions and concerns. During the ongoing PFAS response, the Health Department has been involved in several vapor intrusion investigations throughout the Kent County area. The public health response required in these situations has exceeded the capacity and expertise of current staff and will require continued involvements for years to come. The proposed epidemiologist's position would provide the Health Department with the skills to provide subject matter expertise, conduct health surveillance, coordinate specimen collection, exercise legal authorities when applicable under the direction of the health officer, communicate with residents and health providers, and be the primary intermediary with other agencies. The total cost of salaries and benefits for the full-time public health epidemiologist position is $95,920. This cost will be funded by general funds previously appropriated to the 2017-18 Health Fund budget via Board Resolution 928-1775 for emerging issues.
So moved.
Motion by Commissioner Korndike for consideration. Do I have a second?
Second.
Second by Commissioner Skaggs. All right, let's open it up for questions, comments. Adam again. Anyone have a question or comment? Commissioner Steck?
Thank you. Adam, what's the status of the potential funding from the state? I know that they approved some funding this past fiscal year, or for the current fiscal year. Is this potentially recoverable funds if we go ahead?
It is potentially recoverable. There is $2.5 million in the existing budget for local health departments. There are currently 15 PFAS investigation sites around the state. There's still a question of how that $2.5 million is going to be divided amongst those local health departments. There's also money proposed in next year's budget. So there will be recoverable funds from the state for this. Even setting aside PFAS, though, we've got a number of other issues as well. Vapor intrusion is very concerning for us. We were heavily involved in the vapor intrusion situations last year at Hall and Madison and the Trek site here on the south side of downtown. And we know that the same team from the DEQ who's been working on PFAS this year is the team that does vapor intrusion. Basically, they've had their hands full with PFAS this year. They have 3,000 vapor intrusion sites to investigate in their queue. And so we know that there's going to be a trickle of these for a long time to come, actually a flow of these for a long time to come. And I hope that those additional investigations will also have some support as well. The reason we're asking for this now is we're not waiting for them to finally get straightened out what their mechanism for delivering those funds to us is going to be. We recognize it's a priority, and so we're going to move because we have the resources in our own budget right now. But what we do expect to recover a great deal of this.
This is an issue that's also generated an awful lot of litigation. Is this a compensable process? I know that I don't think that we're looking at litigation on behalf of the county at this point, but
I have had some discussions with regard to the potential for getting our expenses related to PFAS back. There are a couple different avenues we're investigating at this point, but it'd be a little bit premature to go into some of those details right now.
it is a possibility.
It is a possibility.
Commissioner Skaggs.
Thanks, Adam. Could you just tell us a little bit more about, what the day-to-day or week-to-week job description and what this person will be up to, and then, what are the requirements for this job, educational requirements, background requirements, et cetera, and are we going to be able to find somebody to fill this?
I believe we will be able to find someone to fill this. Fortunately, through our academic health department, where we've been partnering with the universities and their graduate programs in public health, we receive about 10 to 12 graduate students at the health department. So we've already built a pretty good relationship with a number of individuals locally who'd be qualified. We're looking for someone that would have a master's degree in public health, preferably in epidemiology. Their work day to day will be to be that subject matter expert in issues such as PFAS, issues such as vapor intrusion and lead. We want this person to take leadership of the lead task force as well. That person will be doing the consultation with the people who have been exposed in homes that have had problems with PFAS or vapor intrusion. That consultation has consumed a tremendous amount of our time. Everyone wants to talk, rightfully so, with somebody at the health department about what this means for their family. This person will be doing that. This person will be the point of contact with the Departments of Environmental Quality, Department of Health and Human Services, CDC, the EPA. This person will be part of doing the health surveillance. One of our great challenges in the northern Kent County area is, as we know, with PFAS, there are a number of questions out there. What does it do? What have we actually observed in terms of health effects in that northern part of the county? We really need to have a person who is focused on comparing the prevalence of illness there with other parts of the county so that we can, in a more timely way, identify if there is a health consequence observed. So that's it in summary.
Great, thanks.
Commissioner Cornick.
Thank you, Chair. So this person's going to have a lot on their plate, lead and vapor intrusion and PFAS. Are they going to be able to handle it? Is this one person going to be enough to take care of all these problems, Adam, or are we going to need more?
Similar to opioids, we're going to aggressively pursue other options to improve our response.
So you really could use 2 people, we just need to find the funding somewhere, or 3.
Yeah, I can't say how many to deal with these problems because these problems are enormous.
They're huge. I mean, and who knows where we're going with the vapor intrusion. You said 3,000?
Yeah, statewide.
That's a lot.
It's a tremendous.
Do we have an understanding of the cause?
Of the cause of the vapor intrusion?
Yes.
It's varied.
Okay.
Just here in the 2 sites we dealt with last year, one was a dry cleaning operation, and the other was a petrochemical operation along the old train tracks. So industrial is really the one thing they have in common.
Okay. All right.
Any other questions? Commissioner Ponstein?
Thank you, Chair Bolter. Adam, all 3 of these are on the radar of the federal government. I heard both of our U.S. senators tell me that. Is there any hope that the federal government is going to step in? Because PFAS isn't a Michigan problem. It's across the United States. Have you heard anything?
Nothing that I would say is actionable information. I have heard through our colleagues at federal agencies that these issues are seen as emerging and important issues to be dealt with. Whether or not there is some relief or a resource that is added either at the federal level, state level, or locally available to us, I just can't count on right now. And because I can't count on it, I think that I'm bringing these requests forward because I do have a resource within my circle of control to do something locally.
Any other questions? All right, Adam, thank you. I think, as you guys may remember, we did add the PFAS issue to some of our funding requests from the legislature, but obviously we don't wait around in Kent County, so I appreciate Adam's forethought and push on this. All in favor of this issue, say aye.
Aye.
Aye. All opposed? All right, moving on to Commissioner Miscellaneous. Any Commissioner Miscellaneous today? Commissioner Stack?
So just one note, I had the ability to listen to the live broadcast of the meeting last week, which was interesting.
Riveting.
And it identifies how many viewers. It said 1. I guess that was me. But as I pass this on to Pam, and I saw on the note, the sidebars do get picked up on that, so we don't have mute buttons on our little microphones here, but just a word of caution.
Commissioner Skaggs? Did you have any?
No.
Oh, I'm sorry. Any other commissioner miscellaneous? If not, we are adjourned. Thank you.
That was a great meeting, sir.